CLL, or chronic lymphocytic leukemia, is the most common form of leukemia in Western countries, with about 15,000 to 16,000 new cases a year. It is distinguished from another disorder called SLL, or small lymphocytic lymphoma, simply by the number of circulating lymphocytes in the peripheral blood. If you have fewer than 5,000, then it's considered SLL, or small lymphocytic lymphoma. If you have greater than 5,000, then it's CLL. Since, first of all, some patients may fluctuate between one and another. You may see them one time they have 3,500 lymphocytes, the next time they have 5,300, and it's the same disease. And since the cells, the malignant cells, appear identical under the microscope and have the same immunological and genetic features, it's basically one disease. We call it CLL/SLL, and therefore CLL is a lymphoma. Most patients with CLL/SLL are diagnosed incidentally. They show up at their doctor's office for a check of high blood pressure, or they come in for a colonoscopy and the doctor does routine blood tests, complete blood count, and the lymphocyte count goes up and everybody starts to panic, until the diagnosis of CLL is made and the patient is referred to someone who knows about the disease, who can put the whole disease and the future of the patient into perspective. There are a number of things that a newly diagnosed CLL/SLL patient should know. First of all, that most patients with this disease live a long time with appropriate therapy. Second, they should probably get an opinion from someone who is expert in the treatment of this disease, because there are major advances in our understanding of the biology of this disease, as well as incredible new treatment options that are becoming available. When you're diagnosed with CLL, it's important to be able to separate out what's real information and what's misinformation. There's a lot out there on the internet. Everybody in your family and their friends and their friends' friends will be coming at you with stuff. And there are reliable things and reliable places to find that information, and there are unreliable. One of the most reliable is clearly the Lymphoma Research Foundation website, lymphoma.org, which has a subsite for chronic lymphocytic leukemia, which describes the diagnostic tests, the treatment options, the supportive care, and lots of other features about the disease that it's important to know to live with this disease and to be managed appropriately.